Welcome to the BioBalance Healthcast, episode 674. Myths about post-menopausal women that block women from what we need.
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. And now I'm going to talk to you about something that I talk to my friends about all the time. And it's probably a broken record for them, but it may be new for you. I find that most of us, when we turn 40-something and we go to the doctor like we should, and we tell the doctor the symptoms that we have, they go like this. Nope, put us in file 13 and say, you're just getting old. And then they don't have to give us an answer. Then they don't have to give us any kind of direction on what we should do about our symptoms of premenopause or postmenopause. So if your doctor dismisses you, or if you have had trouble getting your insurance to pay for premenopausal hormones, or you have PMS and somebody's told you, oh, you're just crazy, go to see a psychiatrist, then I think you know what I'm talking about. This is a very common circumstance. People usually come to me after they've seen 4 or 5 other doctors who told them there's nothing wrong with them, or they should just live with it, or they should just be happy they're not fertile anymore and having babies. Honestly, the reasons that they give us for blocking us from getting an answer and a care that for what we need are ridiculous. And they've been going on for centuries. So this is nothing new. We didn't live very long. Not many people got to menopause in the 1940, up to the 1970s. So honestly, our life expectancy really didn't bring most women into the menopausal or premenopausal range. But then we did not have many of our rights. We didn't have the right to be denied a job because we had children at home. We didn't have a right to not be admitted to med school because we didn't look like a doctor, like I was. That's what they told me. Don't look like a doctor the first time I tried to get into med school. So now there are a lot of doctors that look like me. But so we have achieved some portion of equality, but there is an equality we haven't. And that is what people say about us when we're over 40, and how they say it, and how that impacts our ability to get what we need. So there are many myths that are propagated by people, not always men. Sometimes it's by the media, and they don't even know really what they're saying. But many of the myths that have been carried into the 21st century have come from the past, and they just keep being repeated. One of the myths I ran into, and I will talk more about on another healthcast, was Dr. Roach in the St. Louis paper has a column, and he's usually somewhat right on with medical issues and how to deal with them. Women or men write letters and ask questions. But somebody asked questions about polycystic ovaries, and he clearly knew nothing about polycystic ovaries, but that didn't stop him from writing an answer. And he said, women who have polycystic ovaries have too much male hormone. Well, that's a myth. We have testosterone, and so do men. So testosterone is not a man's hormone. It's both of our hormones. We get to have it too. And so just by propagating that myth in one of his statements that led to the rest of his improper advice, it just wasn't current. It wasn't even semi-current. He dissed the patient. She's abnormal. She's got men's hormones. That's not right. Just as an aside, polycystic ovary disease is inherited. It's becoming more common, and it has to do with insulin resistance, weight gain, too many adrenal hormones that are androgenic, but it's not pure testosterone. And sometimes it's too much estrogen and testosterone from the ovary, but I'm just giving you an answer to that myth. And the myth of testosterone being just a man's hormone is truly inaccurate. So most of what I found in terms of myths that patients have told me, what doctors have told them about their hormones or about why they can't be treated. One of the statements that is a lie is that women love the freedom of being in menopause because we don't have to have babies every year. Well, we haven't had to have babies every year since the pill came out in the 1960s. So that whole line of thought is ridiculous, and we don't feel good in premenopause or menopause. We don't have the hormones anymore that we used to have. So that makes us deficient. A deficiency in medicine is something that should be replaced. If you have thyroid deficiency, you get thyroid medication. If you have deficiency of cortisol, you get cortisol. So it's similar to that, and it is a lie that we're feeling so free and happy when we don't have any hormones anymore and we're menopausal. Another myth is that women like Nikki Haley was dissed because she was over 50. And of course, she's menopausal. She can't be president. She probably won't be able to think straight, or she may be having emotional surges, which will make her unreliable. And really, compared to the other two people that would have been running against her, that's ridiculous. She was the most down-to-earth candidate, and in my mind would have been great for women and would have been great for this country. But having said that, that's what they said about her, and people actually embraced that reason not to support her. So how can we think that we can have a job after 50 and people will advance us in our careers, which they'll listen to us and take our advice? They think we're just old and don't know anything. And that's simply not true if we are proactive and take care of ourselves, diet, exercise, and most important, hormone replacement. But that's what we're swimming upstream against. There's always somebody saying, oh, you don't need that. Do it naturally. Just exercise. People have been told that and then come to my office, and when they're finally treated, they're like, oh my God, I'm back. I have my life back with just 4 months of hormone replacement with pellets. It isn't easy. It seems easy when you're a patient. It isn't easy from the physician or nurse practitioner standpoint to actually manage these hormones. But there's a lot of things that are hard to manage in medicine. Sometimes we have to do surgery. That's not easy. Sometimes we have to do complex treatment plans. That's not easy, but we still do it. For some reason, because it's women and because we don't count, they don't even care to think about it or to take care of us. American College of OBGYN is supposed to be the expert on women, and they still don't say that testosterone is one of our hormones that comes from our ovary. So if the expert in our medicine says that's not true, yet we have scientific data that proves that we have testosterone when we are in the childbearing ages, then we don't stand a chance with individual doctors because they're getting their information usually primarily from this organization. Okay, another lie. That women who have symptoms of menopause are overreacting. We're overreacting to our symptoms of menopause, of not being able to sleep, hot flashes, having brain fog, being fatigued, gaining 20 pounds in a month or two. We're overreacting to that. If a man had it, there'd be a cure immediately and the FDA would approve it. But since there isn't, it isn't for men, it's us, then if we were just stronger, that we should really be able to do this all by ourselves. Well, that's just a lie, and most people who have had menopause or premenopause know that. Not replacing your hormones leads to diseases ongoing. And so not replacing your hormones actually sets you up for heart disease, high blood pressure, diabetes, autoimmune diseases, and frailty, where we end up not being able to take care of ourselves. So it is definitely a choice. If you want to be tough and you want to think that you are strong enough to overcome your own hormones, then go for it. But you're not going to feel like my patients who have taken hormone replacement and then don't get all these diseases as they age, and you will be at risk for many of these diseases. So hormone replacement isn't risky. It's less risky than going without hormones. And that's the truth. I feel like Rosanna Dana. And if you're my age, then you know who that is on Saturday Night Live. Women just complain about menopause symptoms to get attention. I mean, really, we can get attention lots of other ways. We don't complain about menopause symptoms in fact, we probably don't complain enough. And the first time a doctor or somebody with knowledge says, you shouldn't worry about that, you should just suck it up and go about your business, and we believe them, that's the problem. The problem is we're believing them. That's not an answer to this. We aren't complaining because we enjoy complaining. We're complaining because there's something wrong and we need a treatment. And that usually is what medicine's role is. Medicine should be offering us an answer to this. And most doctors say, oh, I don't believe in hormones. That's their answer. It's not a religion. I mean, I don't care if they believe in whatever religion they believe in. If they're my doctor, they're supposed to treat my symptoms and my problems. And so it's a really difficult problem if you're not a doctor yourself and you don't know the answers scientifically, then you can just quote me. Then there's the belief that all of women's symptoms, anything that we complain about, no matter what it is, having to do with childbirth or menopause, they're all in our head. That we have a psychiatric disease. Having 2 X chromosomes gives us psychiatric diseases. And that's crazy in itself, because that's a throwback to the 1800s when a man could actually put his wife in an insane asylum if he just couldn't divorce her for some reason. Maybe he was Catholic, maybe whatever. He just wanted to get rid of her, put her in an insane asylum. Just they would believe him and not her, and she'd be locked away the rest of her life. So that was very common then, because women we couldn't vote, we couldn't stand up for ourselves. We were literally possessions, and that's changed, at least in some ways. But that's a throwback to saying, we're crazy because we have menopause symptoms. It's very physiologic, and it is not a psychiatric disease. Now, you can have a psychiatric disease and menopause. That's possible, but it doesn't cause psychiatric disease, and it doesn't make you crazy. They are just symptoms of a problem that you need help for, and the longer it goes untreated, the worse you get. There's a movie called Hysteria, because hyster is uterus. Hysteria means that you go crazy, act crazy, and you're hysterical means that you're causing a scene. So hysteria can only happen to a woman, because only women have uteruses. So a man can't be hysterical. So if you are accused of being hysterical and you're female, then the misogynist that called you that should be, I don't know, sent home from school or something. I don't know. They have not grown up and progressed like they should have. And there is a movie called Hysteria, which is really funny. It's about the 1890s, and it's about medicine in the 1890s, and women going to a doctor who, you'd have to see it. I can't really describe it here, but you can rent it or get it on one of the paid channels. It's really funny. Funny in a way that you can laugh about it, but it does portray the predicament of people, especially women in that era. We just can't have that anymore. Honestly, we've progressed so far. We put people on the moon, and we, still don't have a well-explained treatment for menopause, except in certain little areas like my practice, where we've sought out the information and looked for the research, and we know the answers, but it's not blessed by the FDA, and it's not blessed by our American College of OBGYN. Sadly, because they're still run by guys. Women who complain about bleeding all the time don't need a hysterectomy. That's another myth. Probably about 15 years ago, the insurance companies realized how they could save money. And when they do save money, they try to save it on women's diseases, because then there's more money for their heart disease and orthopedics and things like that. So I was in a group of people with people who were making these decisions, and I was listening to them, and they literally were talking about how they were going to lower what doctors were paid to do a hysterectomy to so low that doctors wouldn't do hysterectomies. Now, there are times when women need hysterectomies. When they're bleeding all the time, anemic, fatigued, bleeding all the time is a bad thing for anybody, but bleeding all the time that you can't stop and it's from your uterus, even if it's not cancerous, the uterus has to come out. If you have intractable pain from endometriosis, your uterus and your ovaries need to come out. These are things that are just like having your appendix out or having an ovarian cyst out or having a part of your bowel resected because it's abnormal. It causes you pain. These are things that we really should be treating by taking the uterus out. It's not the worst thing. I've had a hysterectomy, and now that I know how to replace my hormones, can't even tell by just sitting here that I've had a hysterectomy. You don't know, you can't feel it, that you don't have something. And by them manipulating this to doctors, by doctors looking at doing a hysterectomy going, I don't get paid for that. I'd rather stay in the office and see patients in the office. I get paid more. Well, that saves the insurance company a lot of money for anesthesia, operating room, hospital stay, all of those things, and the doctor's fee for that. Of course, the doctor's fee has been discounted so much that I did that for 1 year, and I paid more when they first started this in my malpractice insurance just to have the privilege of operating than I made operating that whole year. So I was paying somebody so I could do surgery and do hysterectomies on people who needed it. And they came to me from everywhere because nobody was making money on it. So that was my donation to womankind at that time. Now people come to me from other states and say, I hysterectomy because no doctors will do it. I do have a couple of doctors who will do hysterectomies here in St. Louis, but I don't have them all over the country. I don't know who will and who won't. And these folks are really miserable. It's really bad for you to lose that much blood all the time or be in pain all the time. And you have a very high chance of getting hooked on painkillers if you are. So the answer is just get rid of the disease. Now, another myth is women's menopause symptoms happen because they have behavioral symptoms. They have behavioral problems. It's like saying because you have ADD, there's nothing we're going to do about it, and you have to just live with it because this is just who you are. Just you have these symptoms because you have a bad behavior or you were brought up wrong or something in that order. And this comes to pass, and this actually was brought to me when a magazine and journal called Menopause Magazine, believe it or not, had an embarrassing article about women and menopause and suggested that here's what they said. They said, with some women reporting minimal symptoms and other symptoms substantially impaired their quality of life. That was attributed to bio, psychosocial, and cultural factors. So not physical factors. So they found that people in third world countries don't complain about their menopause symptoms. And I'll just say that they don't usually get to menopause because they have bad water. They don't have immunizations. They're not well taken care of medically. So I'm not sure how they could find a lot of menopausal women in third world countries. But they don't complain about it. And of course, if I was having trouble surviving my life, eating, finding clean water, I would probably have not complain about my menopausal symptoms either because I had bigger things to complain about. But the fact that this magazine, who is given to doctors who take care of menopause, writes it off as a behavioral problem, really incensed me, as you can tell. And it just brings out all of the other inequities in medicine where money and attention and drug research is passed off to do for men or for both sexes, but not for women and children. There are over 14 types of testosterone for men approved by the FDA, and there are none for women. Why is that? They had the testosterone patch that was to be approved. They denied it on the basis of facial hair, which is not life-threatening. And they pass a lot of things off as some aesthetic problem, like facial hair, which you can just have waxed off or whatever, or lasered off. then that's a reason not to give you a drug that would treat your whole body. It made no sense. In any case, that is just my best example, but there's many more of how we can't get what we need. They don't think we need it. They think we're crazy. They'll treat PMS with psychiatric drugs instead of progesterone, which is what it should be treated with. So this is a huge problem that isn't over. I mean, it's almost 2025 and it's not over yet. And I thought all of this would be settled by the year 2000. And of course, it just keeps going on. So if you want to not be depressed about this, find a doctor who listens to you. Find a doctor who hears you, that will take your symptoms realistically and replace your hormones with one thing. They can get rid of all your symptoms. You don't have to take a pill for every single symptom. You take one thing, one hormone or two hormones to treat all your symptoms. And feel free to walk away from a doctor who won't listen to you. Sooner or later, they'll get the picture. So, and if you want to be entertained, watch the movie Hysteria, and you'll see what I mean. But that would never have been written in 1800s because it wouldn't have been funny. It would have been true. So please understand that you're really okay if you complain about your menopausal symptoms, and you deserve help with them, and you deserve treatment. So I hope that this gave you some encouragement in your quest to have a good quality of life for the rest of your life. Thank you for listening.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth.